now in the thick of my fourth pregnancy, and we've officially wrapped up the second trimester a few weeks ago. I am just now taking time to sit that down and really reflect on that second trimester as I transition into this third and start to approach that incredible due date, which is Christmas Day. And so that feels wild to say out loud. But the second trimester deserves its very own episode, just like the first trimester did, because I always feel like it's that sweet spot in pregnancy. Your energy starts to return, your bump is noticeably growing, and movement just starts to feel better again. So if you haven't yet listened to the first trimester specific episode, scroll back through and listen to that one. And if you find yourself in the second trimester, welcome. I'm so glad that you are here. If you're not currently pregnant, this can be so helpful to just know ahead of time so that when that time comes, you feel equipped and prepared and not blindsided by the different changes your body is going through. In today's episode, I will walk you through how I approached exercise during the second trimester as a pelvic floor physical therapist and now as a mom of almost 4, the why behind movement choices during the second trimester, how to avoid the most common aches and pains because it's typically at this time that sometimes they can start to creep in, and then a few holistic ways to nourish and support your body as baby continues to grow. So second trimester, you may have referred to as the sweet spot in pregnancy by friends or family. This makes sense because it's the time that energy levels improve because our placenta starts to take over hormone production. Nausea often subsides, allowing for better appetite and activity. Your bump is visible, so it's no longer, oh, did I just eat too much? No, there's actually a visible bump there, and it's a little bit more obvious that you are pregnant. However, it's not quite so big yet that it is limiting in your mobility or in how well you feel as you are moving about your daily life. Personally, this trimester always feels like the best time to move my body. I even forget that I am pregnant on most days until I go to get dressed and realize, oh yeah, I can't wear the same things that I typically can anymore because of that growing bump, which is a beautiful thing. In my first 3 pregnancies, we planned a trip right around that 20-week of pregnancy mark. And so if you are proactively planning, if you know you're pregnant, let's say you are trying to conceive now, or you're in that first trimester, planning a trip around the 20-week of pregnancy mark is absolutely the best time to go. You are pregnant and you feel pregnant in that sense of just that pregnancy glow and it just being this special time in your life, you and your partner's life. But you also feel much better. Usually, like I said, your energy's back, nausea has subsided, that kind of thing. So at 20 weeks of pregnancy with my third child, we went to Banff and Jasper National Parks in Canada. We brought our other 2 children, we hiked, and I had our 40-pound toddler boy on my back, and my husband had our 4-year-old daughter on his back. And that was quite the workout. So this is also the time where we're out of that first trimester, which if you listen to the first trimester episode, you'll hear me talk about how we really want to focus on supporting your nervous system. We don't want to overload it. We don't want to do anything too high intensity just because of that increased risk of miscarriage in the first trimester specifically, and that there have been studies to tie in exercise intensity with miscarriage risk. And so as we enter the second trimester, the body has established that placental organ. As I mentioned, that is now taking over hormone production, and it is a time where you can exert yourself more and not have a fear of doing so in terms of how baby is doing, okay? So if you've been active before pregnancy, you can continue to be active during, and especially in the second trimester, it's okay to let intensity pick up a little bit, just like our big hiking trips. So baby number 3, we were in Banff and Jasper hiking with baby number 2. When I was pregnant with our second child, we took our first kiddo to Grand Tetons National Park and did Yellowstone and Glacier National Park. So again, a lot of hiking, some elevation, exerting myself more, but again, I felt really great. Now, this 4th pregnancy, my husband and I decided to do something a little bit different. This was the first time our pregnancy wasn't necessarily planned. So we actually traveled at 8 weeks of pregnancy, which, reflecting on second trimester travel versus first, my goodness, I would rather travel in the second trimester for sure. Even though you have more of a baby bump, just the way your hormone production is, you feel so much better in the second trimester typically. So We went to California, did Yosemite National Park and Big Sur when I was 8 weeks pregnant with this fourth baby, and a lot of hiking. I felt good overall, but I did just have that in the back of my mind the entire time you're in your first trimester. You need to take it easy because of that knowledge of exercise intensity and potential miscarriage risk. And so I bring that up just because it really can be helpful when you're planning not only your exercise, but also travel. Because if you're somebody who enjoys being active while you travel like myself, that's really important to consider. So ideally, travel during the second trimester. You're gonna not only feel better, but you can also be a little bit more intense and that be okay, right? So at the end of my second trimester with this fourth pregnancy, my husband and I decided to do a getaway, just us. We have not done a trip, just the two of us, in over 2 years. And so we flew out to Denver, Colorado. You know, that's the mile-high city. So you're already starting out at a mile-high elevation. Thankfully, you know, I hydrated well. I used my electrolytes. I had a good supplement plan in place before we even left. That the elevation did not matter to me from like a elevation sickness standpoint. I didn't get any of that. But I certainly noticed when we were hiking that I was way more breathless. And my husband was too. So it wasn't just me, but I could certainly tell like I couldn't keep up with him like I typically would had I not been pregnant. And so understanding that elevation can certainly impact you, especially as you're further along in pregnancy. So for that trip, I was about 25 weeks pregnant. So actually 27 weeks pregnant. So I was right at the end of my second trimester. We like literally snuck it in right before that transition to my third trimester. So as mentioned, right around 20 weeks is definitely the preferred sweet spot for traveling, but not being afraid to do so when you're pregnant. If you're going to, second trimester is the time to go. So the other thing I want to touch on here, just, you know, this being the sweet spot of movement, is that for baby number 4, it's important to note that exercises looked different than it did with my first 3 pregnancies. It is more spaced out, more little 10-minute snippets throughout the day versus one nice 20 to 30-minute solid chunk at one time, just because our daily rhythms look so different. We have a 20-month-old little boy who I typically rise with in the morning, and sometimes we're going on a walk together. Sometimes he'll move in the basement with me. Sometimes he just wants to snuggle on the couch and rest with me and doesn't want any of the lights turned on, and that's okay. And so recognizing that each day can look different and it's going to look different with each subsequent pregnancy. So not to put too much stress or pressure on yourself. And as we go through things here about why movement matters and what important movements to incorporate into your daily rhythm, know that this needs to be tailored for you. And that's what I help patients do who come in one-on-one. You know, for some patients, it's a 30 to 45 minute specific program that they can do. When it was my first pregnancy, that's how it looked for me. Now with each subsequent pregnancy, it's looking like shorter, smaller chunks, but interspersed throughout the day. So it's still adding up to potentially that same amount, and I'm still getting the same kind of work in. It's just more spaced out. Now, movement during pregnancy is not about necessarily staying fit. It's about supporting your body that is doing the most incredible work imaginable, which is literally growing new life. Okay. So when it comes to movement in pregnancy, think of that as your goal, right? Not having an aesthetic goal, not having a, new lifting max goal or a new race PR goal when we're talking about fitness. Instead, shifting your mindset to support. This is about supporting your body to do the most incredible work imaginable, which is growing new life. Now, during the second trimester, the hormone relaxin and the hormone progesterone both increase. This leads to a rise in joint laxity. This thus tends to need greater stability for the body. And so a lot of the exercises I start incorporating at this time are focused around stability, especially for the pelvis, because this is when women will start to come into my office with things like sciatica, low back pain, sacroiliac joint pain, hip pain, right? Sometimes even rib pain as that rib cage starts to grow and expand with growing babies. So stability is definitely very important in the second trimester. This is also the time when we start to notice the center of gravity shifts. So we have more load in the front, obviously, with that growing baby. And so this shifts because of the curvature of our spine, more load and more compression to the spine. And then the hips, because of the pressure of baby through the pelvis, and the pelvic floor is that lovely muscle group right at the base of that pelvis. This is why I typically recommend patients begin one-on-one physical therapy in the second trimester if you have not already done so. It allows us to stay ahead of the curve from so many pain points by addressing your alignment, your muscle tension, and your ability to coordinate these muscles earlier on so we can catch issues before they start screaming at you. In the second trimester, blood volume and cardiac output also increase. So aerobic exercise becomes really beneficial for circulation and stamina. After pulling running out during the first trimester because of a desire to keep my intensity levels lower, second trimester is typically when I add running back in. Someone will feel good continuing to do so in their first trimester. For me, it's just simply risk benefit. I'm okay with using other exercise methods. Second trimester, it usually feels really good to add in some walk jogs again, some running again, and just really listening to the body, monitoring for any pelvic floor symptoms. If you start noticing leakage or pelvic floor heaviness, that would be a sign to back off in intensity with that running because your muscles are just having a hard time handling that load. Now, movement in the second trimester is going to improve your lymphatic flow, which you may hear of women complain, particularly in the third trimester, about swelling. And so if we can stay ahead of it, right, then we're going to have less issues down the road. So movement is going to improve your lymphatic flow and will improve digestion, which constipation can certainly be an issue for women as baby grows and kind of presses on those bowels. So by helping move our body, we're helping move that digestive system. And then blood sugar regulation. I have an episode all about gestational diabetes screening, and we touch about blood sugar regulation, and movement is a really key component for a healthy pregnancy when it comes to that. Now, benefits of consistent movement are decreased risk of gestational diabetes and preeclampsia, both conditions that we want to avoid, of course. Movement improves pelvic alignment and reduced hip and back pain. And with this, I will say, not doing the right movement or too much of improper movement form can lead to malalignment of the pelvis. And this is why I recommend every single pregnant woman work with a pelvic floor physical therapist, because we can make sure that the movements that you are doing are right for your body. I cannot tell you the number of women that have come in to our office with an extremely rotated pelvis, and they've been having SI joint or back pain for years. They've been seeing a chiropractor once or twice a week for months, and their pain hasn't gone away. Well, it's because they're still doing the same things when it comes to a movement standpoint. And so that's where a physical therapist such as myself and my team come into play, because we can look at how your body's actually moving with the exercises you're doing. We can tailor an exercise routine specific to you, and suddenly that pelvic alignment goes away because we are now making sure that we're not continually being pulled back out of alignment. So that's just kind of a note of caution. If you're somebody who keeps going back to the chiropractor for adjustments and you keep being out of alignment, there's a reason why you're always out of alignment. And that is really why bringing a physical therapist into your care team is so important, because we can help determine from a muscular standpoint and an exercise standpoint why that's occurring. As soon as we stop whatever movement pattern is bringing you out of alignment, you're not going to keep going out. You'll maintain the adjustment and you'll stay in alignment and have way less pain and discomfort. Before we dive back into today's episode, I want to make sure you don't miss something really special happening next week. It's almost Black Friday deal week here at Holistically Well. 5 full days of my most meaningful offers of the entire year. These are the resources and support I wish every woman had access to as she navigates the sacred seasons of womanhood. And next week, they're available at the lowest prices you'll see. Each day comes with a brand new deal, from holistic programs to exclusive wellness support to one-on-one appointments you can use throughout 2026. If you want instant access to all 5 offers, just DM me BF Week, all one word, on Instagram, and I'll send everything straight to your inbox. You can also check the show notes for the direct link to view our 5 days of deals and begin planning for your favorites. These offers only last through Cyber Monday, and when they're gone, they're gone. So if you've been feeling the nudge to step into deeper healing, stronger habits, or truly personalized care, this is the perfect time to begin. All right, let's get back into today's show. Now, benefits of consistent movement also are helping you stay in alignment, because then we can train stability in keeping you there, okay? Better sleep, reduced anxiety are another benefit, and then enhanced endurance for both labor and as your starting point for postpartum recovery. So the stronger you go into labor, the stronger you're going to come out, the more healthy you will come out. The healthier you go in, the healthier you come out. And so movement is a huge component of that. So if you had to let movement go in the first trimester, here are your reminders as to why it's so important to keep it front of mind in this second trimester. Now, around 18 to 20 weeks of pregnancy, my clients often start asking, what is safe to do, right? A lot of gyms will have constraints around once you hit around 20 weeks of pregnancy, where they may have limitations on what they suggest you do. They may say you can no longer lay on your back for exercise. Heck, some gyms will even say that for when you enter your second trimester, so around 14 weeks. This needs to be individualized. So when blanket statements like that are given at the gym, I encourage you to, again, work with a provider one-on-one so you know your body specifically. And then 2, to advocate for yourself. You can tell your coach or, the group fitness class leader, I understand that that's your blanket role. I actually feel good exercising on my back still in pregnancy. And I know the signs to watch for, which would be numbness and tingling in your hands, nausea. Again, I have a whole episode on this. It's breaking down the myth of if you can exercise on your back during pregnancy. So be sure to listen to that. But advocate for yourself because you know your body better than anybody else. And so don't let those blanket statements stop you from doing movements that actually feel good. What to focus on in the second trimester from a movement standpoint. Number 1 would be functional strength and core stability. So we need to prioritize the deep core system. This is your diaphragm, your transverse abdominis, which is that deep core muscle that lays deep to lower than, inner towards your organs, underneath all of those rectus abdominis muscles and your obliques. So your deep core muscles, your transverse abdominis muscle, and it wraps all the way around to the backside, where you also have a muscle called your multifidi. This is that back portion in your low back. That is your full core system. So when I say we're working the core, we aren't just working the abs. We're working your diaphragm, your core muscles, your pelvic floor on the bottom, and then the multifidi, the low back muscles on the backside. We want to focus on coordination, not just contraction of these muscles. And typically this gets brought in with breath work. So breath work with movement. As we inhale, we want to expand through the belly, side ribs, low back, and pelvic floor. That gives length to those muscles to then fully contract through a greater range of motion. So inhale, expand, exhale, gently engage and contract. And you can think of that engagement from a 360-degree basis. We're getting pelvic floor to gently lift. We're getting deep core to wrap in, obliques and low back to wrap in. And so it's really this hug of you, hug of baby when it comes to that core activation. And then on the inhale, we're getting that expansion in 360 degrees, like a balloon is expanding with air. So doing gentle loaded movements like a half kneeling chop with a dumbbell or a medicine ball in hand. You could do side planks and add in some rotational movement. You could do farmer's carries where you're holding a weight in one hand and then you're breathing diaphragmatically as you walk. Will help you connect with that whole system. I also like incorporating breath work that's going to tap into this deep core system with functional movements such as squats and then deadlifts or hip hinges. This will contribute to full body strength, particularly again, if you're adding in some external load, you're involving the upper body there as well. And it will have direct carryover to things like lifting your baby after they're born, right? So now's the time to train this area. I do want to know you can improve strength during pregnancy. So even if you took a step back in that first trimester, you start working out consistently in the second trimester again, or a little bit more intensely, you can increase weight. So I think there's this adage that, because you're pregnant, you can only lift at 60% capacity of what you usually would. Well, if you continue to get stronger, that 60% capacity is going to keep growing, right? So let's say you start lifting back out at 10 pounds for biceps curls. I'm A-okay with you increasing to 12 pounds and then 15 pounds as long as your body keeps feeling good, because your muscles can strengthen and grow during pregnancy just like any other time. So important to notice that your training volume can increase, your strength profile can increase in this functional strength and core stability section of pregnancy movement. Now, common cues that I like to give are to exhale on the effort. So we want that engage and lift, that wrapping of the deep core and pelvic floor on the effort. So that would be when you're coming out of a squat, when you're rising from a lunge. Soften the ribs is another cue I like to give during core work to make sure we don't have upper ab gripping. When we're really gripping tightly from the top down, it sends pressure down into our pelvic floor, which can lead to symptoms such as a heaviness feeling in the pelvic floor, which can be prolapse, or leakage, urinary leakage of the bladder through that pelvic floor wall. So soften your ribs and really get that bottom up contraction. And then another common cue is to let the pelvic floor lengthen before it contracts. So this goes back to that breath. On a squat, for instance, we want to inhale down, get length into the pelvic floor, and then exhale, engage and lift. The second category, so first category was functional strength and core stability for exercise in the second trimester of pregnancy. The second category is glute and hip strength. So these muscles directly attach to and support the pelvis, which is that integral bony place that houses our internal reproductive organs. That's where your baby is growing. That's its support structure, right? Commonly, we will see in the clinic sciatica and sacroiliac joint pain or SI joint pain and back pain, hip pain, right? Strong, coordinated glute and hip muscles go such a long way during pregnancy to help support this area. So sample moves for this would be side lying clamshells, both the regular knee opening and then a reverse clamshell where you actually keep your knees together and lift the lower portion of your leg. Standing hip abduction, so standing lateral leg lift, doing single leg Romanian deadlifts, doing an 80-20 stance of a deadlift, doing lateral lunges here or sidestepping with the band. There is a multitude of exercises, and I break down a lot of movement routines specific to the glute and hip regions in my Holistically Well Pregnancy program, because these two muscle groups are absolute powerhouses when it comes to keeping your body feeling good during pregnancy. The third region we want to make sure you're including in an exercise routine throughout the second trimester of pregnancy would be mobility and balance. And so often women get caught up on I need to be strong. I need to be strong for pregnancy. We do to support that growing loaded baby, but we also need to be mobile because when it comes to labor and delivery, the body's whole job is to surrender to the contractions, to surrender to baby moving down and through the pelvis. And if the pelvis doesn't know how to open, if the hips don't know how to open, and if the pelvic floor muscles don't know how to relax, labor can stall, significant tearing can occur, and increased interventions can take place that do not need to. And this, again, is why I like working with women, ideally before they even become pregnant, but at least once you're in the second trimester, please reach out because we need to start incorporating these things now. We can't just wait until the very end and expect the muscles to all adapt super duper quickly, right? We need to be incorporating these types of things throughout pregnancy. So spinal and hip mobility is so important for both space, creating space for a baby, but also circulation. So we mentioned swelling can sometimes be an issue down the road. When we have good mobility through our muscles, through our fascia, through our joints, it can also help improve that lymphatic flow. So many layers of benefits to this. Now, some of my go-tos when it comes to mobility would be cat-cow. So you're on your hands and your knees, you inhale and extend through the spine, and then exhale round through the spine, letting the head hang heavy. You can do that in seated as well. Hip-controlled articular rotation. So you're on your hands and your knees, and you move that hip joint through its full range of motion. I also love thoracic rotation. So on your hands and your knees, you can put a hand behind your head and inhale to open through the spine. Exhale, close it off. And then adductor rock back. So we want to help open up that bottom portion of the pelvis. So you can have one knee down, one foot off to the side. Inhale, hinge back, hips to heel. Exhale, come up. So those are some good go-tos. But again, so much more where this came from. You can find it all inside the Holistically Well Pregnancy program, or when we work together one-on-one, we build a toolbox specific for you. These I recommend incorporating 3 to 4 times per week. And then you're doing the strength training about 3 to 4 times a week. And then the aerobic conditioning you're working in throughout the week as well. So we are doing a variety of things every single week. Now, the fourth and final category is going to be that gentle conditioning, aerobic conditioning. So that would be like brisk walking, maybe jogging if you feel good with jogging, perhaps it's swimming. We want to keep up that cardiovascular output because of that increase in blood volume. It's so important that we help assist that circulation. And so aerobic conditioning is going to be key for that. I like saying keep your steps around 7,500 plus, ideally 10,000 plus, but 7,500 is really where we see this huge rise in benefits, and then it more slowly goes up after that. This would be on a daily basis that we're incorporating walks. Maybe a few times a week you're doing the jogging if that feels good, or swimming. That certainly I don't think should be every day. But walking absolutely should be a daily activity to assist with that aerobic conditioning. All right, so I mentioned that we would touch base on nourishment in the second trimester and the key things that I like to focus on. Number one is making sure you're getting enough protein. Aim for at least 100 grams per day through real food, and then supplement as needed, such as collagen or bone broth or a good quality protein powder. I will put my favorites in the show notes. Mineral balance, making sure you're getting daily electrolytes in for hydration, energy, and then muscle function. When we are strengthening our muscles, they are only going to respond and adapt as well as how we fuel them. So that's why electrolytes and then protein are very, very important. Using a whole food prenatal, making sure that you continue that is very key. And being conscious that our soil quality is not as good as it used to be. And so you can't typically get all the micronutrients you need simply from food sources. I highly, highly recommend supplementation. And if you need assistance with this, please reach out. I'm happy to help. Real Food for Pregnancy by Lily Nichols is my go-to resource for all things nutrition during pregnancy. So if you haven't already, I recommend reading that book. It can be really good to reference throughout your pregnancy. All of this needs to come back to real life integration. So between running a business, getting my kiddos to and from school and preschool, growing another human, running a household, being a homemaker, balance looks very different these days than it did in my first and second pregnancy. And my third, honestly, each pregnancy is completely different. And so candidly, as I mentioned earlier, getting exercise in, it still happens, but it's in smaller snippets throughout the day. And that's why in my Holistically Well Pregnancy program, I made the movement routines more short and sweet. I had requests from women for movement routines to be anywhere from 10 to 20 minutes so that they could intersperse it throughout the day. And it's been so fun going back to those videos that I created during my third pregnancy and moving through them myself now this fourth pregnancy, and really appreciating the 10-minute videos because I can do one. Okay, now I'm gonna go change the load of laundry, or now I'm going to go see another patient, right? If it's an office day, and then maybe that evening, then I'm doing an evening wind down mobility routine that's at around 12 minutes. So I'm still getting 20 to 30 minutes of movement in a day, but it's just broken up into smaller snippets versus all at once, as it perhaps had been with my first or second child. If you're in your first or second pregnancy, you can press play on back-to-back videos. You can do the same video twice and get some extra circuits in of those exercises. So it just gives you a ton of flexibility. And I want you to recognize that you get to define how movement looks during your pregnancy, during your life season. And for all of us, that's going to look different. So simply giving yourself grace and knowing that there are options to support you from the comfort of home within my Holistically Well Pregnancy program, no matter what season of life you find yourself in, whether this is your first pregnancy or your fourth. All right, so inside of the Holistically Well Pregnancy program, my goal really is to help you feel strong and supported through every trimester. I just want to put a little plug in for it here because if you're looking for movement support in that second trimester of pregnancy, know that it is here for you, and you can simply press play from the comfort of home. The link is in the show notes. Just go to drkaylaborchers.com/pregnancy and use code POD20 for 20% off. If you learned something new in today's episode about exercising in your second trimester of pregnancy, please leave the show a review. Let me know what spoke the most to you. And I am so excited to continue supporting you throughout your women's health journey. Until next time, take care, my friend.